Hello, I'm Greg Jamian, and welcome to Boomer Health at Home. As more baby boomers receive medical services at home, there are many questions that pop up that require sometimes quick answers. I have put together a series of short segments with healthcare professionals that will help explain how things work, along with answers to common questions found in home-based care. I hope you find the following information helpful.
Hello and welcome to another episode of Boomer Health at Home. I'm your host, Ryan Donnellon. You know, on the show, we'd like to try to bring relevant issues to help you stay healthy at home and really highlight some of the topics that maybe the baby boomer generation is facing and maybe get some innovative things going on in the health field. So to continuously do that, we like to bring new faces on the show. So to kick it off, to the man to my left is you've probably seen him on a few episodes before, but I don't think you've ever been formally introduced. Brett Pulte. Take it away.
Hi, my name's Brett. I'm the Marketing and Communications Specialist for AmeriCare Medical. We handle basically anything that's in-home medically needed. Myself, I actually, after high school, I worked in television production and found that for myself, that wasn't the right career path, so I went back to school for marketing. I graduated from Walsh College and just started getting to it. This is my first job in the healthcare realm, but I'm absolutely loving it. You know, everything that I've done up to this point, it's opened my eyes to something new. And I work with a ton of smart people, a ton of people that know exactly what they're doing, and that's helped me tremendously.
Right. Well, speaking of smart people and people who know exactly what they're doing, if we're honestly going to do a show about medical advice, I don't think anyone would really trust our credibility. So that's why we bring medical experts on. So joining me across here is Joyce Ward. Joyce, I know we listed already that you are a registered nurse. Can you tell us more about your professional background?
Yes. I actually have been in the healthcare profession in one form or another for over 40 years. I've been a licensed chiropractor since 1977, and I have been a Bachelor of Science prepared nurse from Wayne State University for the past 14 years. I have taken master's preparation courses towards my nurse practitioner degree as well. It has yet to be completed. I am a certified case manager by a national certification agency. I have worked as an ICU nurse as well as a case management manager for a couple of our local hospitals. I was a home care nursing manager and a home care nurse for 4 or 5 years as well. I'm also the primary caretaker for my 92-year-old mother, and I am part of what you would call the sandwich generation. Just got the adult children out the door and now taking care of aging parents. So you're kind of getting it from both ends, which can be, and while still trying to work towards your own retirement and your golden years. So it's a challenging time of life for most of us now.
Wow. So you really do have a full 360-degree view on healthcare. That's great. Well, we're happy to have you on the show.
Thank you.
With everything that you've ever done, what was your favorite part of healthcare that you worked in?
My favorite part of healthcare was actually, really as a home care nurse and a hospital nurse, was that personal interaction with the patients. I love people. I especially like elderly people. Their wisdom and charm can be amazing. They a no-holds-barred attitude, and they'll tell you what they think. But that's the most satisfying thing, being able to teach them something, to help them, to educate them. I love that personal interaction with my patients.
Well, very good, and that is our main goal here on the show. So that's why you are a perfect fit. So I'm glad you're on. So. Question I have, so I mean, we love our Bloomfield community and educating them and offering some of our experience to them. What would you say is some of the top 5 things going on in healthcare, the world today that maybe the baby boomer generation is not privy to?
Well, you'd probably be surprised at the hospital admission level. Fully 50% of our patients that are admitted to the hospital these days are Medicare patients, those 65 and older. Almost 80% of medical resources that you use during your lifetime are used in the last 2 years of your life.
Wow.
Statistically. A huge precipitator of hospital admissions is fall, diabetes, congestive heart failure, and a number of other conditions, and they're all intertwined. Okay, and sometimes we are isolated from our families, are spread out. You might not have that daily interaction with your loved ones, especially those aging and still in their own homes and so forth. And it makes it more difficult, I think, to manage them and to help them to have a healthy and productive senior existence these days.
And that's always important to stay on top of everything. So I mean, what type of trends are you seeing today that the baby boomers can really stay on top of and need to learn more about?
Well, the number one thing is number one, getting into the home, having interaction with that person, having a really good relationship with your physician. If you don't have a physician that you can call or ask or is educating, make sure that you change physicians in order to do that. You have to have continuity of care. That's the big kind of catchphrase these days. You need to have the same providers, the same pharmacy, and everybody needs to be working together, and you need to have somebody that actually knows your situation in order to help you come up with a comprehensive and appropriate plan for care.
Okay.
And then, on top of all that, what's one piece of advice that you would give to anyone watching this show?
To educate yourself. Really, you have to be a participant in your health care. Our parents especially came from a generation where they didn't ask questions. The doctor told them to do it and they do it. And there's multiple resources. Your physician should be number one. They know you. They know your personal health history. They know your psychosocial situation. But you can go online these days. CMS, the Centers for Medicare and Medicaid, has a great website that can direct you to many resources. There are many resources within Southeast Michigan also that can help you find and direct you to information. Information is everything, and you need to educate yourself and actually participate in planning out your healthcare needs and your aging in place plan.
Absolutely, I can't agree more. And the good news is, to you, those of you watching at home, you've already done the first step. You've tuned into the greatest health show to give information on there on television. So kudos to you. But going forward, I think that's going to be our main goal, is to bring good education to you, and we hope you enjoy it. We also like to take your input. If you would want to come in here and maybe suggest a topic you'd like Joyce to talk about or all that, we would love to hear from you. We're going to actually wrap this show up, but going forward, we look forward to working with the community, working with you, Brett. Thanks for being on.
Thank you.
Joyce, it's a pleasure having you on the show.
My pleasure as
And
well.
if you do need to contact us, and the email should be located below maybe, and we will be happy to answer any questions and on any content. Thank you, and the number to call would be 248-288-2270. Thank you for watching.